Betty, my name is Lindsay. I'm going to be your nurse today, helping you with your blood transfusion. You'll be getting a transfusion because of the GI bleed that you had going on for a while now. I'm going to wash my hands. And Betty, can you please tell me your name and date of birth? Betty Jones, 5/21/1952. It matches. I've checked my chart. I know that this is what we have to do. Next, I'm going to check your vital signs. So I would do your respirations, your heart sounds, your lung sounds. And I don't hear any crackles in the lungs. If I did, maybe we could give you some furosemide or something like that to help get rid of some of that extra fluid. And I see here that you have signed your consent form, so that's good. And have you ever had a transfusion before? She says yes, so good. You kind of know what to expect then. And yeah, so next I'm going to check your IV site to make sure that it's patent and things are going to run good. But first I'm going to put on my clean gloves. Clean gloves. All right. Alright, so there's no tenderness at all, no redness or anything like that. Everything looks good. I'm going to wipe it clean for 15 seconds, and then I would let that dry. Make sure there's no air bubble in here. And I'm going to use about half of this after I unclip here. Alright, seems to run through smoothly. So your IV site looks good. Okay. Alright, do you have any questions? No? Alright, I'm going to set up the first the sodium chloride, normal saline. So I can prime the line, and I would squeeze this to the drip chamber to make sure that the red blood cells don't hit the filter. Okay, it looks like we have the air out of the line. Alright, and that's primed and ready to go. So now I need my blood. Hi, Nurse Carl.
Hi, Nurse Lindsay. I have some blood for you.
Okay.
1 unit.
Thank you. First, when I get the bag, I'm going to check that it's not damaged. The color of the blood is good, no discoloration, no blood clots or anything like that, and just gently move it back and forth. Okay, we have Betty Jones here, and Betty Jones is on her name band, and her date of birth is 5/21/1952.
I have Betty Jones, 5/21/1952.
Med record number 224466.
Med rec 224466.
Location HLRL.
Location HLRL.
Account number 123456.
Account number 123456.
red armband number 456654.
456654.
Okay. And her blood type is B positive.
And blood type B positive.
Donor pool number 7890.
Donor pool number 7890.
Units in the pool is 4.
Units in pool 4.
Volume 250 mils.
Volume 250 mils.
We have packed red blood cells here.
Packed red blood cells.
Expiration date 12/22/2020 at 2000 hours.
Expiration date and time 12/22/2020 at 2000 hours.
Donor blood type O positive.
Donor blood type O positive.
Compatibility test completed.
Compatibility test completed.
Date 7/6/2020.
Date of 7/6/2020.
All right. Thank you very much.
You're very welcome.
All right. So I have my red blood cells here. We checked it all out. Everything is good. Next, I'm going to pick it up.
But first, we're going to go ahead and verify that we have the correct patient before we get into the specifics. So we have
All right. So that one is picked up.
that's what she says to me, but I just don't know. So we verify the other correct patient. So now we can get into the specifics.
All right.
We see that Miss Eddie Robinson found the consent form, so has Dr. Avery. That's all good.
I'm going to prime the line now. So I'm going to
We're going to talk to her about possible transfusion.
close the saline
And she mentions that
and open the red blood cells.
so I said that's great. Do you happen to recall some signs and symptoms of transfusion reaction? And she says hives, itching.
Okay, and I would prime it just till it's right before the end, just so we don't lose any red blood cells. But we've primed it. Oops. So that's good. Alright, now I'm going to connect to our patient.
That's all good.
And I'm going to wipe it again here.
And we also want to add that if she feels anything,
Let it dry.
she's just gonna let us know. It's not necessarily an indication of something bad's happening, but we just want
Alright. I'm gonna hook it up.
that situation so that we can look into it. You know, so we can be safe and sound. So she's all going about that.
Alright, so that's all hooked up, primed. Ceilin's closed, red blood cells are open.
Now we will verify
Right now, the pin is on.
so we have our blood products.
New patient, yes. Med surg, yes.
And she's gonna go ahead
Do 1, 2, 3. Confirm. Channel select A. Guardrail IV fluids. Page down to blood. Red blood cells, yes. Okay, the rate, we're gonna start out at 50 mils per hour, just to, in case a transfusion reaction occurs. Or say if they were a small child or a very frail elderly patient. Okay, and the volume, our bag has 250 mils in it, so we're gonna do 225 here. And we're going to start it and make sure all of our clamps are open. Okay, so that looks like it's running good. And I would stay in here with Betty for 15 minutes just in case some kind of transfusion reaction did occur. And at that 15 minutes, I would also check her vital signs and check her lung sounds again. If a transfusion reaction did occur, I would stop the transfusion immediately. I would get a new bag of saline, a new tubing, and hook that up. And then I would have another nurse come in and monitor her while I contacted the doctor to see what he wanted us to do. And then, so once the bag gets down to, after the 225 is done, I would just finish it right until, or I could after the 15 minutes, sorry, I could, if everything was going well, I could bump her up to like 120. So I could channel select here, and then I could change the rate to 120 after that, just to speed it up a little bit. And then start. And then everything went well, say the bag got down to after the 225, then I would come back in and I'd let just a little bit more run out to give her the best benefit of the red blood cells. And then I would stop it so no air got in the tube before it was completely empty, and I would then start her on saline to flush it out. So I would pause it here. Clamp that. And open this. And then I'd let the saline run. For, let's say 30 mils, and that should be enough to flush out whatever's left. And then we've got that left. So then after all the red blood cells are done, I would unclamp her, and then I would use more of the flush to flush her IV. Again, I would do that after it's all done. And then make sure she's comfortable, she has her call light, all those things. I would clean up my area, wash my hands, take my gloves off, wash my hands, and then I would check the vital signs again, and then you should check the vital signs every 30 minutes to an hour as the transfusion's happening too, whatever the policy is for that facility. And then I would document, and I would document the blood that she received, the amount, the blood unit number, the start and stop time of the infusion, and how the overall experience went. And I think that's it.